All right, is that showing up for everyone?
We can see it.
Okay, great. All right, let's see. Cool, we're at 31. It looks like we're back. Good evening, everyone. All right, we're gonna finish anatomy. I'll try not to take the rest of this hour and a half here. I think we can get it done a little bit quicker than that. So, we were talking about the nervous system last time. Let's see, we were on the meninges. We had just gone over the central and peripheral nervous system. So just a broad categorization of, if we can get back to it, remember the central nervous system is the brain and the spinal cord. And can you all see my mouse on the screen too, if I'm like moving it around here to highlight stuff?
We can see it.
Okay, good. All right, so yeah, the central nervous system going to be the brain. Peripheral nervous system is everything else. So we talked about the parts of the brain. We won't go over that again. And please stop me if you have any questions or if you want to ask Sam or Patricia anything about EMS correlates here. So these are just the layers of protection for the brain. You have your skin, your bone, and then something called the dura mater, which actually means tough mother in, I think, like German or Latin. Dura means tough, mater means mother. So it's just this very tough casing around the brain. It's like this leathery skin-like stuff. And then in that you have brain tissue and some other tissues in there. The important thing about this for EMS is you also have cerebral spinal fluid in there. It's fluid that surrounds your brain and spine. That's why it's called cerebrospinal fluid. And if you were to see someone with a really nasty head injury, you might see some of that actually leaking out of either their ears or their nose or even an open fracture in the skull. That would be a sign that you've broken through the bones of the skull and through the dura mater, and you have a very significant head trauma. So if you ever see clear fluid leaking from someone's ear or nose or anywhere on their head, that is a bad sign. That means they're leaking this cerebrospinal fluid. So it's what's the brain is suspended in. It's like having a brain in a jar. This is the fluid that keeps it nice and fed and everything. It also takes waste away from the brain. It keeps it in a happy state. It regulates the pH and everything else around the brain. All right, we all know what the spinal cord is. Comes through to the brain in a large hole at the back of the skull. Travels inside the spine. I think we know all that. The cauda equina is just the end of the spinal cord. If we go back here to nervous system, this down at the very tail end, there are going to be a bunch of nerve fibers coming off the end of the spinal cord. This is the cauda equina, and cauda equina means horse's tail. So it's just like a horse tail is made up of a bunch of hairs. This is like a tail for the spinal cord made up of a bunch of nerves. Right. So the neuron is the unit of the nervous system. Everything is neurons connected to the brain. So everything is going to travel back to the brain. And these are all just very long cells. So if you see all these nerves traveling through the body, these are actually just a few cells with very long, what are called axons, or very long projections that reach where they're receiving signals from. So the nervous system is kind of interesting in that there are these very long cells that travel very long distances in the body. That's kind of unique as far as cells go. All right, we all know the nervous system controls the body. So you have two nervous systems. This is going to be getting into more medical applications. That stuff is kind of dry and abstract. But if we're talking about the voluntary and involuntary or autonomic nervous system, this is what we're going to be looking at more with medicine, because when people are exposed to certain situations, their nervous system will change body functions based on those exposures. So if you have like a heat exposure or a cold exposure, or if you're really afraid, or if something's going on in your body, then your nervous system will automatically respond to it. and that's the autonomic nervous system at work. So it's useful to understand some of the most common responses of that nervous system. And then, of course, you have your voluntary system, which just, moves your muscles, does what you want to do consciously. So anything from your body's organs is going to come through the autonomic nervous system, and then your brain processes it and generates a response, which means that anything happening inside your body, like I said, if you have a trauma, if you have some sort of issue, if you have an exposure to heat or cold, the body is going to form a reaction automatically. And so you can either anticipate those to make sure that they don't harm a patient, or you can use them as a sign of something going on inside of the patient. So understanding what the nervous system is doing is important in taking care of people. This is just more on the autonomic. So if you take the automatic or autonomic nervous system and divide it into two parts, there is a sympathetic part and a parasympathetic part, or divisions. So the sympathetic division controls the body's pain, fear, sudden loss of blood. These are like what we call the fight or flight responses in the sympathetic nervous system. This is like if you're just walking down the street and you see a bear and it comes charging at you, this is the part of your nervous system that would immediately kick into gear. And why do y'all think, what's the utility of having a nervous system like this? Why would we have a sympathetic nervous system? Why does that help humans? Let's
respond to threats to yourself. I mean, for survival.
Yeah, perfect. So it's a survival mechanism. So the sympathetic nervous system is going to keep you alive, and you can keep that in mind for EMS as well. If you have some horrible insult to the body like massive blood loss, it's also going to be the thing that keeps you alive in that case. So when you see things like increased blood pressure and increased heart rate, that could be because you're preparing to fight for your life, like against some attacking animal. But also if you're losing a lot of blood, or if you're septic and there's something very wrong inside your body, those are going to be the same exact mechanisms that help you survive that too. So the sympathetic nervous system is the survival nervous system. Whether there's something wrong internally or something, a threat on the outside, it's what kicks into gear to keep you alive. And I always think sympathetic, like you feel sympathy for someone, you feel bad for someone maybe. Like sympathetic nervous system feels bad for you because you're in danger or you're being harmed. So that's like an easy way that I remember it. And then the parasympathetic is just the other one that is the opposite of the sympathetic. And if you're just sitting on the couch eating potato chips, the parasympathetic nervous system is going to be regulating most of your functions. So if you think that if sympathetic is the fight or flight, what do y'all think the parasympathetic nervous system, if it's very active, what sort of things do you think would that do to your body? You could think heart rate, blood pressure. How do you think those things would be affected?
They go down.
Yeah, fair enough. So heart rate goes down, blood pressure goes down, and things like GI function or maybe even readiness to sleep will increase, like sleep hormones. So you can call this one the rest and digest nervous system. So sympathetic is fight or flight. Parasympathetic is rest and digest. So they're opposites. And again, so if you see like a sympathetic response in someone, if you see someone with a really high blood pressure and a really fast heart rate, it could just be fear. It could be a response to something. It could be a sign that something's going on with their body. So you're looking for these sympathetic cues. Also, like a lot of sweating is something that is common to people who are either afraid or have something seriously wrong with their body. They might be drenched in sweat. So if you see someone who looks like they're fighting for their life, it could be a sign that they are. There could be something very wrong there. All right, we just talked about fight or flight. They add a few more things: nausea, diarrhea, dry mouth, sweaty palms, just things that it'll shut down most of your systems that you don't need unless you're fighting for your life. So you don't need your stomach working while you're fighting a bear. You don't need to be making saliva. So you start to feel the effects of the rest of your body shutting down so it can divert energy to that fight or flight. All right. We're continuing. Yep. And this is just saying that adrenaline, epinephrine is going to be what causes this response on the chemical level. And it'll be responsible for a lot of the physiologic things like heart rate and blood pressure increase that you see. All right, digestive system. We just knocked off neuro. Also known as the gastrointestinal. Gastro means stomach, intestinal means intestines. So this is your stomach plus intestines. That's the whole digestive system. Of course, we know that it processes food. All right. This is very important in EMS. This is really commonly used. The 4 quadrants of the abdomen. If someone has pain in their stomach, you need to describe where it is in the 4 quadrants of the abdomen, because that vastly changes the differential that whoever you're delivering that patient is going to be worried about in certain circumstances. So for example, right lower quadrant pain is the most common presentation of appendicitis. So instead of saying this person came up to me and started complaining that their abdomen hurt, that could be a million different things. But if you tell someone that you're handing a patient off to, this person came up to me complaining of right lower quadrant pain, that's a much more narrow differential. It could still be a lot of things, but immediately you're going to be thinking of common things in that area, like appendicitis. So you have to, if you can, isolate pain to one of these quadrants. You should be doing that because there are different things in each quadrant, which we will be going through here. All right, so we're talking about digestion. Mechanical is chewing food. Chemical is everything after in your stomach. All right, I think we all know how the GI system works. We chew and eat food, it goes to our stomach. Don't need to review that. All right, so this is just organs that are lesser appreciated. The pancreas secretes juices or enzymes that break down your food. And then the liver breaks down fats by making bile. The gallbladder is also in there. Another example of the upper right quadrant, if we go back here, the most common cause of non-traumatic right upper quadrant pain is going to be the gallbladder is like right here. That's really common for someone to get gallstones and just have this pain that won't go away right in the right upper quadrant, or in the liver there too. If they have problems with alcohol or they use some medication in too large an amount, right upper quadrant will be where their pain comes. So you can see how you can tie certain issues to certain areas in the abdomen. And that's why it's important to describe where the pain is in the abdomen. All right, we're still talking about digesting food. I think we all get that. Okay, so stool or feces is the leftover food that forms in the colon. And we are good with that. I think we all know that. All right, urinary system, 2 kidneys, bladder, and then of course, male or female anatomy for the rest of the way. Urine is byproducts of the body. So urine is the way of getting rid of the body's waste. That's why if you know someone who has to be on dialysis, it's because they cannot make urine. So they need a machine to clean their blood. The kidneys are the body's way of cleaning most toxins out of it and expelling them. So actually very important and kind of underappreciated. And then we have the kidneys, the ureter, the bladder, and the urethra is the full urinary system. The kidneys are in the lower back. So if y'all have heard the term kidney punch, or you kind of know that like a low hit to the lower back is dangerous for the kidneys, that is why. I mean, these are relatively easy to damage, especially if you break a rib in that area, they can puncture the kidneys. So knowing that someone has a lower back trauma, whether it's penetrating or blunt, you could be concerned for a kidney issue. And especially if someone says that they are peeing blood, then that should raise your suspicion for kidney injury. It could be anywhere in the urinary tract, but it could be the kidney especially. All right. So we talked about the kidneys keep nutrients and excrete waste. And they do control the water balance in the body. So they are the ones deciding how much salt to keep your blood pressure up, or how much to get rid of excess water. All right. And actually, I'm just going to make one last point here. This is going to be relatively uncommon in a mountain setting, any sort of assessment of the urinary system. You might ask someone if they seem to be suffering from altitude sickness and you think they're dehydrated. You could try and gauge their fluid status by asking if they have urinated at all that day. But in terms of like physical assessment, you're never really going to assess the genitourinary tract unless you really believe that there is trauma that needs like bleeding controlled in that area. Just a note for EMS, like you almost never get there unless it's pregnancy, like an active delivery, or there's trauma that needs bleeding control. So just don't think that you need to go examining that for anyone, because I think everyone would be uncomfortable with that. But it is a good way to gauge fluid status. All right, the endocrine system is ducts and glands that secrete hormones. Endo means inside, exo means outside. So if you hear these words in medicine, endo sounds like in and in. Exo sounds like exit, so X out. So the endocrine is dumping hormones into your body. There's also an exocrine system, which dumps them out of your body. All right. So hormones change many functions in your body, very broad. They control really every function in your body is going to be controlled by these hormones on some level. And then these are just some of the major hormone glands. You got your pituitary, hypothalamus, thyroid, adrenals, and pancreas. All right, pituitary is the master gland in the brain. It secretes at least 8 different hormones that are well known, and probably others that we don't know about. So we will not go into those, but it does quite a bit of work there. The hypothalamus also works with the pituitary. It's kind of the pituitary's master. It is in the brain as well. So the hypothalamus and the pituitary work together to control the body with their various hormones. They send messages to each other, and then those messages go out to the body in the form of hormones. The thyroid is somewhat applicable to EMS. So this is, if you've heard of someone with hypo or hyperthyroidism, the thyroid gland secretes one hormone called thyroid hormone that stimulates your body a lot like the sympathetic and parasympathetic nervous system. If you have a ton of thyroid hormone or too much, you will feel on edge all the time. You'll be like shaky and you'll lose weight, and your body will constantly be in go mode. You'll be sweating and constantly moving and dropping weight, and your heart rate's really fast. On the other side, if you have hypothyroid, you will be the opposite, where you'll gain a ton of weight, your heart rate will be very slow, you'll feel really tired all the time. So the reason this is applicable is if someone is taking thyroid medication, if that comes up in an H&P, and then they have some weird symptom of like fatigue, or they have some weird hyper anxiety and they're just off the wall, then it could be related to their thyroid medication. And there's not necessarily anything that you would do about that immediately, but it is something important to make a note of and make sure that information gets passed down the chain so it can be addressed. So thyroid will affect the body on that very broad level, like either kind of fight or flighty, very up there, or on the opposite spectrum, it can make you kind of really down low. So if you ever see someone with thyroid problems and they seem all out of whack, and they tell you they have hyper or hypothyroid, then make sure you bring that information up later and make sure it gets communicated. The adrenals, we all know what adrenaline is. Adrenaline is the fight or flight hormone, or epinephrine, same thing. So this is what dumps it into the blood. It's these little glands that sit on top of the kidneys. They also secrete cortisol, which is the slower acting stress hormone. So the adrenals actually dump a lot of hormones. These are the ones being highlighted here. But just like the kidneys control balance of fluid and waste in the body, they control a lot of other balances too. And those hormones come from the adrenal glands. Pancreas, this is an exocrine gland, meaning it dumps a bunch of enzymes that exit the body because it dumps them into the GI tract. So those are going to be expelled. And it is for digestion. All the things it dumps are going to help you digest your food. It's also going to dump things into the blood. It's also an endocrine organ because it makes insulin, which of course lowers our blood sugar. And we all, I would think, have heard insulin plays into diabetes. That's an issue with the pancreas when you have diabetes.
I have a question. So the kidney are against your back and they're exactly at that level, basically, here?
Yeah, yeah, that's about right. It's I would be, if you're thinking about it from like a traumatic injury point of view, I would give it a little leeway up and down. I think anything on the back or the side, like the flank in this area, should be treated with caution, especially if you think there are rib breaks. So while like the kidneys do occupy a relatively small area, any blunt or penetrating trauma to this area in general, especially in the back, is going to, and this goes for all organs, it's a major risk. You should basically assume that they might have some hemorrhage or some massive damage to these internal organs, including the kidneys. So yeah, this is like a relatively reasonable or accurate place for them. But it's not like if you don't see someone with a bruise on their back right there, then you rule out kidney damage. You pretty much take the whole area as possible damage to any internal organ.
So they're in the right and the left upper quadrant, basically.
Yeah, I would say that. I'd go more like middle, actually. Maybe,
Middle.
yeah, well, yeah, no. It's, I don't know if I was going to do this, I'd put them slightly lower, but I don't know if I'm just imagining that or if it is the drawing is accurate. But I wouldn't give them quadrant.
Where they show them, you have your stomach usually just right there, and you have the liver
Yeah, that's,
on the other side.
yeah, I agree with you. I think maybe they're a little high, but something you should keep in mind though is they are behind all of the contents of the abdomen. So when you're doing abdominal quadrants, and you're like pushing on someone's abdomen and you're saying, does this hurt? Does this hurt? You're not really going to be able to push on their kidneys because it's hard to tell from this picture, but they're farther towards the back of your body than the front. So I wouldn't think of them in any of the abdominal quadrants. You would think of them more on the back, just surrounding the spine. Is like if a doctor wants to try and poke someone's kidney and see if it causes them pain, they'll go from the back and they'll go just next to the spine on the back. And that's where they'll press to try and elicit pain from a kidney. So they're much closer to the back of your body than the front. So I would not think of them as part of the abdominal quadrants.
Understood.
But yeah, I'd say that's, yeah, close. I'd go look at anatomical pictures on the internet for better detail on that, just so you have a good idea of where they really are. All right, skin, hair, nails, sweat glands, oil glands. This is everything in your skin, which we call the integumentary system, which basically just means your skin is your integumentary system. And of course, it's the barrier that separates us from the rest of the world. I'd say the biggest thing with this in EMS is going to be burn injuries compromise this barrier in terms of both infection and moisture. So if you have massive burn injuries, it's very easy to lose moisture and heat and let bugs into your skin. So you might not appreciate how much the skin is doing until someone has lost a large amount of it, but a large percentage of the body burned is enough to allow someone to become hypothermic very easily. They can become infected very easily because bugs get in through that break. And they can become dehydrated very easily too, actually, because they lose moisture through those burns or large breaks in the skin as well. So that's what your skin is doing, is it's keeping moisture in, it's keeping bugs out, and it's keeping your heat in as well, which we don't fully appreciate, I don't think. All right, it is the body's largest organ. Maybe you've heard that as a fun fact before. We have the epidermis and the dermis. So the epidermis is this up here. The dermis is this down here. Really, the epidermis is like that superficial layer that, like, you might kind of skin your knee and you see some blood, but you're still pretty superficial. If you get down into the dermis, you're going to start to see more dense connective tissue and some glands, and then eventually you'll break into fat. So really, you don't necessarily need to worry about this. A skin injury is a skin injury. They're going to be treated relatively the same. All right, we talked about this, protecting from bacteria, also regulating heat, and controlling body temperature. Yep. This does have an application where the skin will, I think we talked about this a little last time, if you see someone trying to get rid of a lot of heat, then all of these blood vessels, remember, these are the capillary beds. This is where the arteries exchange their blood with the veins, and it's at these capillaries right here. So this is how the body regulates temperature and regulates where blood goes. So if the body is trying to save blood for the core, it will squeeze these capillaries at the surface to make sure the blood doesn't go there anymore. And that will make your fingers turn blue. That will make you get all pale, because all of this is going to be squeezed down tight, so the blood kind of just turns around before it even gets there and goes to your organs instead. And then similarly, if you're overheating and you're suffering from heat shock and your body wants to dump a bunch of heat off, it will dilate these capillaries. It'll allow the heat to travel outward by letting the blood go close to the surface of the body, where it can let off some of that heat that it's storing. So this is what we were talking about, where those capillaries regulate your body temperature and they regulate how much blood goes to your extremities. All right, skeletal system. Over 200 bones. The outer region of a bone is called the cortex, just like the outer region of the brain is called the cortex. In fact, cortex just means outer layer in medicine, and the inner region is called marrow. All right, we know that bones have different shapes and sizes. You have long bones, you have flat bones in the skull and pelvis, and then spinal bones are actually a unique class of bone. All right, where two bones join, they form a joint. Does anyone know the difference between a tendon and a ligament? All right, that's what we're here for. Tendons connect muscle to bone. Ligaments connect bone to bone. So that's all it is. It's still just a very fibrous tissue, but ligaments connect two bones together. Tendons connect a muscle to a bone. So if you sprain your ankle, that would be a ligament that's getting pulled. You're pulling a bone off of a bone by kind of rolling your foot in an improper way. But there are other things, like if you pull your Achilles tendon by bending your foot the other way, bending it too far back, that would be a different type of injury because you've strained both a muscle and you're pulling that muscle off the bone. So ligaments and tendons are similar, but they will be connecting different things to each other and prone to different injuries. All right, movable joints. We have a few types of movable joints here. Ball and socket are what you could picture, a ball in a socket, and it's free to move around, like your hip, your shoulder. And then you have hinges, which are more like a door, like your elbow, your knee, and your finger joints. Those are like hinges. They only go in one direction. All right. Talking about the skull, these are the parts of the skull. We're not going to go over all of the bones in the skull. Those will be something you can study on your own. These are useful to describe where injuries are if you'd like to, especially if you have some facial trauma. You can say that it is to the mandible, the maxilla, or the zygomatic arch are common descriptors of where facial trauma occurs. And that basically means, if you can see my camera, I think you can, zygomatic arch is like the cheek, just below the eye. The maxilla is like the upper lip and lower nose. And then the mandible is the jaw. So that does help people kind of understand what sort of trauma they might be dealing with. Like a mandibular trauma is going to be different from a zygomatic trauma because these often involve the eye, and mandibular traumas often involve like the teeth and dislocations. So specifying like the region of a trauma with a qualifier like this would help someone be prepared to treat it or even care for someone on the way to treatment if they knew where it was very specifically. So it is useful to use terms like this. All right, spinal column has the spinal cord. We have 33 total bones. They are divided into these different types of vertebrae. So cervical is the neck, thoracic is the upper back, lumbar is the lower back. I'd imagine we've all heard of lumbar support, something involving like lumbar pain. As you have a bad posture, you can get lumbar pain. That just means the 5 vertebrae of your lower back, that's your lumbar spine. So that's what that's talking about. And then same with if you've heard of C-collars or C-spine or cervical spine, which we'll get to, that just means the spine of the neck. So we put on a C-collar or a cervical collar to protect the neck. All right, the thorax just means the chest. It's basically everything in the ribs. We have 12 pairs of ribs and the sternum. And then the pelvis. I think everyone would be familiar with a pelvis here. And then all the pelvic organs are in here as well. So that's going to be mostly genitourinary organs are going to be in the pelvis in this little bowl shape here. All right, upper extremities. These are also going to be important bone names. Most bone names, I mean, there are over 200 bones in the body, and I would say that most of the names don't get used commonly if you're describing injuries, but some of the ones in the arm, the really large bones will get used. So you could try and specify like this person has a fracture to their proximal upper arm, and you could say it like that, or you could be kind of efficient about it and say this person has a fracture to their humerus. People know exactly what the humerus is. It's the bone of the upper arm. You say mid-shaft humerus. It's right in the middle of the shaft of the humerus. So it gives you a convenient way to discuss injuries and communicate them with other people. Similarly, you have the ulna is going to be an anatomical position. The ulna is on the inside. The radius is on the thumb side. So if you see, it's common to see obvious deformities in the radius just because of the ways people's arms break. So you could say fracture of the radius with obvious deformity. And again, that will be helpful to people down the line with their care of these people. All right. Same for the leg bones. And there are so many terms coming at y'all right now. I know we're not going to remember all these. So again, I encourage you to go back and review the names of these larger structures that might be used to describe injuries. That would be helpful for you and your communication skills. But these are going to be the largest bones of the leg that will be used to describe things to other people. So femur, biggest bone in the leg, tibia, fibia. It's commonly called a tib-fib if you break both of these. That's like a term in medicine. So you can see these terms are used pretty routinely to communicate with other people. All right, in addition to supporting structure, the skeleton serves as a mineral store, calcium. Calcium is used for other stuff besides just bones, and your bones are kind of the reservoir of calcium. And then bone marrow is where blood products are made. All right, muscular system. What slide are we on? We are almost done here. Let's see. Yep, we're making decent time. All right, 3 types of muscle. There is skeletal, smooth, and cardiac. We were talking about the nervous system types. There's the sympathetic and the parasympathetic type. And then there's also the volunteer nervous system, or voluntary, sorry, not volunteer. So skeletal muscle is able to be moved by you voluntarily. All voluntary muscle is skeletal muscle. So everything you see on this dude who is jacked and has no skin is going to be voluntary skeletal muscle, all the muscles you can move. The smooth muscle is going to be stuff that lines your esophagus or your intestines, and that's going to be the muscle that contracts to make body functions happen without you even being aware of it. Like when you swallow, you don't need to think about the food being squeezed down your esophagus. That's because of smooth muscle like this. It makes sure that things happen without you having to think about it. It's part of that autonomic nervous system. So let's just make sure we understand. In those capillary beds of the fingers of the skin that decide whether blood makes it out to the extremities, they can either squeeze up and keep that blood in the core, or they can open up and let that blood go to the skin. What type of muscle do y'all think is in those capillary beds?
Smooth.
Yes, it's smooth muscle. So that's because you can't think about it. You can't willingly open up your capillary beds. So it must be smooth muscle. If you can think about it and do it, it's skeletal muscle. And then there's one more third special type that is cardiac muscle. And that is just the muscle of the heart. It's almost a mix between skeletal and smooth muscle. It has features of both, but it's probably closer to smooth because you cannot control your heart with your mind. So that makes it closer to smooth. It's subject to your nervous system. All right, we just talked about this. Skeletal muscle is voluntary. A tendon is something that connects a muscle to a bone. We discussed that. So here's a picture of a tendon. You have the muscle, you have the bone, and the tendon is the bridge. All right, skeletal muscles are called fibers. Basically, if you ever had shredded chicken, the reason you can shred chicken is because you're pulling the muscle fibers away from each other. That is how our muscle is too. You just never see it like that. So that is how all muscles in skeletal muscle look. They're just little fibers packed next to each other. Right. So when nerves stimulate muscles, they contract. And then these are the words are flexion for, you know what flexing is, and then extension, we all know what extension is. It's when you make something longer. So these terms are used as well in communicating in EMS. If you say a patient cannot flex their arm or patient cannot extend their arm, someone might have a sprain or a breakage of a bone that keeps their arm or leg locked in a certain position. And that's something you want to communicate with your team members and with people down the line. When they come to help you with that patient, you say, this patient cannot extend their leg, and that ensures that no one tries to extend their leg and cause them pain. Or this patient cannot flex their leg, and then no one tries to bend their leg and cause them pain. So these are important words to be comfortable with. Okay. Yep, and this is just saying that you have counteracting muscles on each side. You have one for flexion, one for extension. That is a common theme throughout the body. Just about every joint has that. All right, and we talked about this. Smooth muscles are in the walls of organs and everything that you cannot control with your mind consciously. And then cardiac muscle shares some properties of both skeletal and smooth muscle. and it is what makes your heart work. All right. Reproductive system. Let's see. So I think we all know what puberty is by experience. And again, with this, just a little caveat, you really will never find yourself doing an assessment on someone's reproductive system unless you suspect there is active bleeding that needs to be controlled in that area. Otherwise, you just don't really go there. Or like I said, unless there's active labor on the mountain, which, I mean, knock on wood, hopefully not. But we all know male reproductive system. All right. All right, this is basically the birds and the bees. If y'all have not heard the birds and the bees talk, I will refer you back to your own parents, and we're not going to do this. For real though, I don't think this is, if anyone has questions, please let me know, but I don't think this is super helpful to anyone. And then female anatomy here. Okay. This is basically talking about menopause and when periods start and end for women. This is somewhat important in, well, actually, it's very important in EMS. If you're just thinking about, you do want to have genitourinary complaints and reproductive complaints like in your differential when you're assessing a patient and talking to them. I shouldn't downplay this so heavily. I'm just downplaying kind of the anatomy of everything because I think we've all had 8th grade health class and it's not super relevant. But pregnancy is something that can cause pain in the abdomen. It can cause nausea and vomiting. And any female of reproductive age with any sort of abdominal or even a constitutional like headache, fatigue, complaint, you should be thinking about pregnancy. And you should always ask, if that is even on your mind, you should ask a female patient, is it possible you might be pregnant? When was your last menstrual period? Especially if they're having abdominal pain, because an ectopic pregnancy is an emergency. That's a pregnancy that is outside of the uterus. So pregnancy in the uterus, great. Pregnancy outside of the uterus can cause a lot of bleeding and even death. So genitourinary complaints and reproductive complaints are important to keep in your mind. I just think that knowing the anatomy in detail and doing a physical exam are less important in EMS, but knowing that this can cause problems is certainly important. And I believe we will have a chapter devoted to that when we get to abdomen. That will come up, ectopic pregnancies. All right, more about the menstrual cycle and the lymphatic system. So basically your body is like a giant sponge. Fluid gets out of your bloodstream, not just what's in your blood. That's not the only fluid in your body. Your body is actually full of fluid. And if the lymphatic system did not exist, that fluid would just sit in your tissue. So the lymphatic system is sort of like your blood vessels. It just collects all the fluid that is not blood and it returns it back into your blood vessels. So we have a picture here. These are called lymphatic vessels, and they are not blood vessels. They're separate. They exist alongside blood vessels, and they kind of just collect all of this fluid that sits in the spongy tissue of your body, and they divert it back to your blood vessels. And so that's important because it keeps all the fluid in your body circulating instead of just sitting there. If you obstruct this, you'll get swelling in an extremity. So if I block up the lymphatic system here, your whole leg will become swollen. So this can happen to people. You might see this in the field. If someone has a swollen leg, like one unilateral swollen leg, and you say like, is this normal for you? And they might say, yeah, I have lymphedema. And you'd be like, oh, it's their lymphatic system does not allow that fluid to drain. So this could come up. And then the spleen is also an important part of sort of filtering this this fluid in your body. It also filters your blood. It removes bacteria and a lot of other stuff from your blood. Okay. Tonsils and adenoids are called lymph tissue. They're like, this system also does a lot of infection stuff. So if there are any infectious things in your blood, they'll be pulled through the lymphatic system to a lymph node. And the lymph node is where a bunch of your immune cells hang out, and they can then deal with that thing. So that's why if you ever heard swollen lymph nodes are a sign that you're sick, that's why it's because those lymph nodes are collecting that lymphatic juice, and they caught some bugs in there, and now they get all excited and they get bigger so they can do their job really well. And that's why you get swollen lymph nodes, because they swell up with a bunch of immune cells whenever they detect something wrong. And so lymph nodes are part of the lymphatic system that drains all that fluid. And then also the thymus, the tonsils, the adenoids that are in the back of your throat, in your chest here, those are basically giant lymph nodes. They're just full of a ton of immune cells. All right, so we just talked about immune response. The lymphatic system does immune response. Leukocytes is just another word for white blood cells. They're produced in the bone marrow. And of course, they destroy pathogens in the body. Okay, and occasionally pathogens overwhelm the defense system. People can die of infections, we know that. And that is what happens when leukocytes or the immune system fails to control pathogens. All right, this is how vaccines work, where you produce something called an antibody, and the lymph nodes in the spleen produce that antibody, and it's always in your body. And so if you had chickenpox, you likely will not get it again because you're going to continue to make those antibodies for it. That's how vaccines work as well. They just train your body to make antibodies for certain diseases that are injected into you. All right, we are almost at the end. So let's see, during an off-road bicycle race, two riders collide. The first patient has obvious abrasions and a deformed wrist. The second appears dazed and his leg below the knee is crooked. All right, what should you do? Let's start with what should you do? These are kind of two separate systems. Who wants to answer what should you do? Let's go like first steps. You get on the scene. What's the first thing you do?
Scene safety.
Scene safety, good answer. All right, so you make sure everything is safe around you and you can take care of these patients. What's the next thing you do? I'll take any answers at this point. I think we're going to continue to build this because I mean, this is what you're going to be doing and you'll continue to work on it. I continue to work on it as you do it. So we can always be building on it. So just because you don't know what you think might be the exact right answer, what do you think you would do at this step early on? What's something you want to take care of early? Anyone got any ideas?
Do a quick analysis and see which person is probably the more severely injured. Start to work on them first. And then once you've kind of got an idea of what's going on with the person that's in worse condition, try to get them stabilized and then go to the other person and start communicating with them and go from there. I'm guessing.
No, that's a great answer. I mean, you should, if you have, this could be called a mass casualty because a mass casualty is just anything that overwhelms the resources available to take care of patients. So if you're one person and you have two patients, you could call that a mass casualty. And yeah, in that situation, triage is important and you want to make sure you're taking care of who needs it first. So yeah, good. Quick assessment of who really needs help. Early on, what other things do you do early on?
Airway breathing.
Good. Okay. So you're going to start with your airway, ABCs, right? Your airway, breathing, circulation. So when you get up to the patient, is their airway patent? Are they breathing? Are they circulating blood? Good. Okay. And a big one for us too is resources. Always think about resources. It's an interesting thing to practice medicine on a ski hill because you kind of need to plan a few steps ahead all the time. So as soon as you see someone, if you see someone who has a deformed wrist immediately, you're going to think they're going to need for sure a sled to the bottom of the hill. They're not going to ski and possibly fall on that wrist. You can't let that happen. And they would also probably need what we have in our trauma bag, which is extensive splinting materials. You can make a really solid splint because they have a pretty significant break in their arm probably. So you want to think early on about like what resources do I need to address this? And then also later down the line, like what kind of EMS resources are they going to need in terms of ambulance, maybe helicopter, or can they just go by car? So what do y'all think? If you see someone with an obvious deformed wrist and someone with a crooked leg below the knee, what level of care do you want to transfer them to?
ALS.
Yeah, I'd go ALS. I think that one's pretty clear. If you see someone with a broken bone, obviously, or a broken joint, you should at least call ALS. And when they get there, you can offer an ALS transport. I've seen people are stubborn and they'll refuse it and they'll be like, my dad will take me in his car. That's their choice, but that doesn't really matter. If you see a significant injury, you should call an ALS transport for that person, just in case they accept it. And usually these people would probably accept that. All right, let's do the second question. What body systems and structures might be involved?
Skeletal.
Skeletal seems like a solid answer. Yes, so we probably have a broken bone here too. What else though?
Really was for the hand.
Yep, the wrist or the hands, absolutely. So you could have hand injuries, which actually are almost above a normal. You can kind of use that to tell someone like, hey, you really should go to the hospital because this can have consequences for like the nerves of your hand. Hands are very delicate. So any hand injury, you can have nerve damage, you can have tendon damage, things that have really long-term consequences and loss of function that people might not appreciate. They might just say, I messed up my wrist, I'll be good in a few days. They might be, but you always want to caution them about, wrists and hands are delicate. So yeah, if you think that might be involved, that'd be something to address.
And then
What about the brain? We're looking at someone who's dazed, so head injury.
Yes. Yeah, very good. So, yeah, good. So that's another thing that on the mountain, we always address that. In our radio traffic, we always specify whether or not someone had loss of consciousness and how alert they are. So even if they only hurt their wrist, you would still ask that person, like, you fell and you hurt your wrist, did you hit your head too? And you make sure they can answer you appropriately and that they are clear-headed to make sure that they're not hurt. So yeah, in addressing a possible neurologic injury is very important, and it's something that we do on every single call at the Lee Canyon Resort. All right, any other systems? There's one big one I can think of. I think it was kind of mentioned, but what do we want to make sure is not happening immediately? There's a traumatic injury. What do you always want to rule out?
No bleeding, internal bleeding, or?
Yeah, good. So circulatory, which could be internal, it could be external. You always want to rule out a major circulatory compromise or massive bleeding. We'll get into some more specific cases later on, but some of the anatomy we talked about, if you have large breaks to like the femur or the pelvis, or you have a lot of trauma to the abdomen, like certain spaces in your body when they suffer trauma can bleed a lot of blood internally. And so, yeah, that's good. You want to look at the circulatory system and you want to say, is this person losing a lot of blood either outside or inside their body? and there will be ways of, you can either see the blood outside, or you can take a pulse and see how strong it is. You can see if they look pale and sweaty. There are a lot of ways to measure that we'll cover more and more later as we go. All right, that's pretty good. So we said skeletal system, maybe nervous system with the hands, maybe a central nervous system with the person who's dazed, maybe circulatory system, given that there was any trauma here at all. You want to be cautious of circulatory compromise. Good. And I think we said muscular system as well. So yeah, that's a solid, even a simple thing like a bike crash, I hurt my wrist. You want to keep all these things in mind because you're just trying to make sure that there is nothing you're missing that will have consequences.
Question, we always assumed that all the people injured are already on the floor, on the ground, because they felt. But if you have only a problem with your wrist, you might just get back on your feet. When you arrive in a scene, do you recommend to have people, to make people sit? Or would you treat them while they're standing? Is there a risk for them to, to fall because they're dizzy or?
Mm-hmm. Yeah, no, that's a great question. I think there are a lot of things that are kind of gray areas and are going to be very scenario dependent. And I think that would be one of them. Because sometimes people after like a really massive trauma, they'll just be dazed and they'll try to get up because they want to just think, I'm okay, I'm going to get up now, when they really should not get up. And they should really probably lie down and have their neck stabilized. And it's up to you to kind of look at a scene and decide, like, is this person reasonable right now? Like, are they just standing there holding their wrist and they say, what's up, man? I hurt my wrist. Can you give me a splint? And you're like, okay, this person seems pretty okay. They probably didn't hit their head. I'll splint them while they're standing up. That's fine, right? You can make that call. Or if you walk up to a scene and you see someone holding their wrist and they're walking in circles, kind of like looking at the ground, they might have other injuries. They might have hit their head. If they look confused or they're acting strange, then you might want to say, hey, let's sit you down. Let's get someone to like stabilize your neck and get a collar on you, because you're worried that they sustained some larger trauma. So it will be very like situation dependent, and you want to just have, you just want to take in the whole scene when you get there to kind of decide what you think happened and make sure you're not missing anything. So that's a really good question. All right. So you make sure the scene is safe. You put on your BSI, of course. After checking ABCs, which was mentioned, great. We look for serious bleeding, was mentioned, great. History and physical, determine the patient with a deformed wrist has no other apparent injuries. As you perform a full head to toe on the patient with a deformed leg, they also have pain in the left upper quadrant of the abdomen. That is specific, we'll learn, for the spleen. And the spleen causes a lot of bleeding. We'll do a whole section on abdominal injuries, but this is a kind of an alarm sign when you say left upper quadrant pain. You could have massive bleeding from the spleen, which we talked about. Internal bleeding was a possibility. When you gently palpate his abdomen, he winces with pain. So you may have missed this finding if you kind of didn't have that on your mind. And then, of course, if you suspect internal bleeding, you're going to request immediate assistance. So great. So everything you all mentioned was there. We did the triage of the non-serious patient. We focused on the serious one. We looked for that bleeding, that internal bleeding, and we made sure that we triaged this serious injury. All right, anyone want to give a description of these injuries to dispatch? What would you mention in radio traffic? And before anyone does that, because we don't have experience with this probably, or most of us don't, when you give a report to someone, whether it's on our radios at the resort and you're just trying to communicate with the rest of ski patrol, or it's to the people coming in to pick up a patient, you're going to usually say the most serious issue that you're dealing with right now, and then any other kind of like influencing factors, like if they have a health condition that is contributing to that, or if they have another moderately serious issue, you would throw that in there as well. you don't need to say everything that happened. Like you don't need to say this patient scraped their knee, but you should mention the main thing going on with a good amount of detail so that these people know like what are they coming here for. Like they're not coming in an ambulance because a patient scraped their knee, but they are coming for other reasons. You want to describe those in detail. So that's kind of an approach to helpful radio traffic. So who wants to try and describe these injuries to dispatch? Let's see. Uh-huh.
Can you go back to the first slide?
Yeah, absolutely.
This is a bicycle race, so there's obviously going to be no snow or limited. So I would start off by dispatch. This is Michael. I've come across a scene where I have two, we know we have a race today, so there's probably going to be some kind of accidents. So dispatch, I have two racers that have collided. One appears to be dazed, so I'm thinking some kind of something's going on with his brain. He has an injury below, one of his legs has an injury below the knee. He seems to be the more serious of the two. The first person has some abrasion, deformed wrist, so probably some kind of a broken wrist. And I will probably need some, at least one stretcher, at least two more people, probably closer to four, because they're probably, neither one of them is probably walking out. And I would try to take, on my second attempt, I'd probably try to consolidate that to a little bit more detailed, so I don't sound like I'm rambling.
Sure. No, that was really good because you hit the main points, which was how many patients you have, sort of your scene, or like you did the mechanism of injury. And we're going to go over in detail like what you include in a radio traffic, but in terms of the main points, you hit the main injuries and then the resources that you would like to address those injuries, which is really like the meat of a radio traffic. So good, yeah. And then you're right, you could pare it down a little bit to be a little more efficient, but that was really good. You might also mention there was the one thing with the, like I said, alarm signs. You always want to make sure you communicate down the chain so people understand how serious things are. And so if you say like left upper quadrant pain and like pain on gentle palpation of the abdomen is kind of scary because that means there's probably something serious in the abdomen. So
Okay.
as you get a sense for like what's really serious, you'll include those in your traffic naturally, because of course that's something you want to communicate. But I don't think we haven't really gone over these much. So yeah, that was a great place to start from.
Thanks.
Of course. And all right, so you notify them. This is your radio traffic here. So yeah, basically deformed leg, decreased mental status, which was in your report. Left upper quadrant pain near the spleen. Second patient, deformed wrist and abrasions, which was in your report. Both have normal pulses and neurologic function. So kind of maybe given a little bit like it's serious, but it's not like airlift serious. Like this person isn't unconscious. He's got normal neurologic function. So you want to give that side of it as well. Like what can this patient do? Vital signs are stable, another good sign that you can relay in your traffic. If you had time to take vital signs, we usually don't do traffic before vitals. And then, we do traffic before vitals usually. And then you request additional patrollers, which is what you did, an ALS ambulance to take them down the mountain. All right, perfect. And we are done. Yep, okay, the happy ending here. Everyone gets out okay. And we're all good. All right, any last questions, y'all? Looks looks like.
How often do you find
Uh-huh.
altitude sickness coming into play with these injuries? Do you find that that is something that you're treating as well often up there, since base is at 8,500?
Yeah, I don't know that when someone has another injury, it really comes into play that often. It is a pretty common solitary complaint, though. We'll get called pretty frequently for someone with either a headache or they're feeling lightheaded, and they want, or their family usually wants ski patrol to see them. So it is a pretty common complaint on its own. When you're taking it into the context of another injury, I would say that anything like lightheadedness or dizziness or like confusion that might be explained by altitude sickness, if there's another injury, you would probably just attribute it to that injury to be extra cautious. So like if someone hit their head and now they're feeling dizzy and you're like, is this altitude sickness or do they have a concussion? You're going to go with the side of caution, and you would never say this is altitude sickness. You'd say worst case scenario, let's attribute this to their injury and make sure that we treat them as if they are seriously injured. Does that make sense?
Yeah, I was just wondering if, like,
Mhm.
when you bring up things like lightheaded, dizziness, you got somebody that's up there maybe not even able to make that judgment call for themselves. Then they proceed to maybe, I don't know, fall, injure themselves. I'm just wondering about concurrent treatment of that, and instead of just one or the other. Do we
Sure.
add oxygen at some point when we're thinking, okay, this person is dizzy, now they've fallen and they have an injury that may be sustained due to the altitude sickness or something like that? Like, that's what I'm wondering, how often does it come into play preceding the injuries? But maybe that's just not something that you guys have had followed or whatnot.
Mhm. Yeah, sure. I don't know how often it would cause an injury, but if you're talking about concurrent treatments of both, the treatment for altitude sickness is just taking them down the mountain. It's getting back to sea level or close to it. So if someone has a serious injury and they're transported to a hospital in the valley, they would actually be being treated for both at the same time. So it would work out for them. So yeah, I guess we never really have to worry about it, because if someone is being treated, then they're automatically getting treated for altitude sickness. But yeah, good question. Anyone else?
Do we use, is it, when the hill opens up at, 8:30, when the lifts start rolling at 9, quarter to 9, is there usually an ambulance already on site, or is that a thing where, the first major accident of the day, then they bring an ambulance up and deal with arrival time?
Yeah, no, so unless it is some peak season holidays, like during the 2 weeks of winter break when we get a ton of high schoolers and families up there, then
Uh-huh.
the Medic West, the ambulance company, will keep an ambulance at our first aid station so that
Okay.
they're ready to transport. And then as soon as that one leaves, another one will come up.
Sure.
And I think we do that on one other, maybe it's like Martin Luther King Day weekend, we'll have that. But it's really only like winter break and then this one other holiday weekend.
Right.
Uh, Besides that, there is the Mount Charleston Fire Department is very close by. So usually if we need an ambulance like immediately, usually we're able to get that. Otherwise, it's Medic West or AMR responding from the valley if Mount Charleston is not able to take our call. And that will usually take like half an hour-ish. That'll depend on their level, but usually they're close enough to get there in about half an hour.
Okay. Great.
Yep. Yeah, so that's if someone needs to be at the hospital in like under an hour, they need to be at the hospital. That's when you would call an airlift because of the constraints on ambulances. And that's if there was not an ambulance already there.
Does
Uh,
Mount Charleston Fire have transport capability, or they're just rescue?
Yeah, they'll usually, I think they'll usually transport the patient down the mountain to meet the Medic West or AMR unit on its way up. And then they'll they'll transfer the patient to that unit. They'll take them down the mountain, and then Mount Charleston will go back to their post on the mountain. So yeah, Mount Charleston can transport. Okay, anyone else?
Yeah,
Go ahead.
With regards to the abdominal quadrants, the costal arch, is that just right, you're basically the bottom part of your rib cage? Is that the delineation point?
Yeah, so costal means it's the medical word for ribs. So it does just mean the bottom of your rib cage. And yeah, I guess that would be kind of the upper limit of any abdominal area. There is another word for that. If it's like right below the costal arch in the midline, you call that the epigastric area, which means above the stomach, because that's about where your stomach lies. So that's like kind of just on top of the two upper quadrants. You have the right upper and left upper quadrant, and right above those in the middle is the epigastric area, right below your costal arch.
Okay.
But yeah, that's all it means, is the arch of the rib cage. And I don't hear that term used much to reference like positions.
Okay. Thanks.
Anyone, but epigastric is used. That's why I threw it in there. All right. Anyone else? All right. Cool. Thank you again for your attention. As always, y'all are doing well, continuing to answer questions with some insight. So thanks for participation.
Thank
And
you.
I
Did a
think
great job.
we're, thank you.
Hey,
I
thank
think
you.
we're good, right, Patricia? We're all good for the night?
We are good.
All right. That sounds good to me.
All right.
All right.
Thank
Good
you.
night, everyone.
Hey, thank you
Thanks.
very much, guys.
See you Wednesday.
Okay, if you have any questions or concerns, just write them down and we'll address them on Wednesday.
Okay, great.
Okay?
Thank you.
Thank
Thanks.
you. Good night.
Thanks, Greg. Well done.
Oh, go
Night
ahead.
all.
Good night. Thank you guys.
Okay.